Hello dear patients and our followers, I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul. Today we are going to share with you the case of the 34-year-old male who underwent a hair transplantation surgery in our clinic 18 months ago. So, the patient had the normal type 4A of the hair loss, meaning the loss of the front hairline, open area on the front line, temples, thinning in the hair loss in the front third, and the beginning of the mid-scalp areas. For this type of patients, on average, we may need the numbers varying between 3,000 to 4,000 grafts. Of course, numbers change from patient to patient depending on the size of the open area, the density you want to acquire, expectations of the patients, but the most important here is the capacity or the ability of your donor area to give us the sufficient number of the grafts. The normal type 4A of the hair loss most of the time means the early stage of the hair loss. When we evaluate the patient, we always stage the hair loss. For this purpose, we use the North-Hamilton scale. And on North-Hamilton scale, the male hair loss pattern goes from stage 2 to stage 7, 1 meaning basically no hair loss. The higher the degree of the hair loss, the higher is the patient set on this scale, and the higher is the demand or the need for the grafts, and the higher is the probability that subsequent or the secondary surgery will be needed to acquire the better coverage and the density. Here we'll go with month by month of the progress of the patient after hair restoration surgery. Here you can see the patient on a third month after the hair transplantation surgery. That's the time when the shock loss is completed and the new regrowth of the hair starts. 6 months is the initial step, or it's the time when the first results are seen. The first results are only around 30 to 45, maybe up to the 50% of the final results. Then is the 9 and 12 months. 9 and 12 months is the time when we expect the growth of the 75 to 85% of the growth of the newly transplanted hair. So here I also want to answer the most common question the patient asks us when we're going to see the results. We always tell that the hair transplantation surgery is the game of patience. So it doesn't work like you do the hair transplantation surgery and the next day you go outside like Marlon Brando with the full head of the hair. No, it's a game of patience. It's a journey. It's like growing a baby. So after the transplantation is done, around 2 to 4 weeks after the surgery, we start to see the phenomenon called the shock loss of the transplanted hair. It's actually an adaptation time needed for the grafts to get used to the environment, recover from trauma, and develop new blood connections. Around 3 to 4 months after the surgery, the regrowth of the newly transplanted hair after the shock loss starts. During the shock loss period, the patients may lose up to the 90 to 95% of all new transplanted hair. So, by around 3 to 4 months after the surgery, the regrowth starts. Around 6 months, we start to see the first results, around 40 to maybe up to the 50% of the final results. And the progress goes much faster. So, around 9 to 12 months, we see the good results. It's around 75 to 85% of the patients. Final results may take up to 18 months. Especially the crown area is the area where the graft after transplantation can maturate the longest time. So here we can see the picture. The normal type 4A means the reconstruction of the front hairline, covering the temples. So, and we can see that the distribution of the grafts went with a much higher density in the front side and slightly less, with a slightly less or like gradient to the going to the back where he still had some hair. So when there is some existing hair, we go in between them so we avoid the trauma to the pre-existing grafts as well. You can see his results around 6 months. Even by 6 months, he already has really good results. But you can see the empty spots in between the front line. Or when you see the third month, you can see the shock loss area, like the patient had never had a hair transplantation surgery, completely empty area. 6 months, you already have an outlook of the hair, and around 12 months, 9 and 12 months, you see that the transplanted hair get more volume and it gives the more coverage and or more bushy outlook to the patients. If you have any questions left, or if you have something to ask, don't hesitate to ask it beneath the video. Thanks for watching us, stay tuned, and see you.